Hey guys, Dr. Michael Derry here, owner of Revision Health Services, and I am a physical therapist, right? So I go to people's homes and provide physical therapy in their homes that's really high level and skilled to help address their limitations and discomfort. But sometimes when I work with people, they've already done some of these exercises before, and maybe they've worked with other physical therapists, or they've worked personal training or any other provider that's prescribed exercise for them. And so that is perfectly fine. I love that, which means we're starting off on the right foot. But I think there's really three things that make a difference in physical therapy for the treatment of lower back pain, and the little nuances that we want to keep in mind, because these three things can make a huge difference on your outcome. And so hang with me. I want to go over those three things so you can know why physical therapy maybe is a good choice for you, and why it's great. It's really effective for the treatment of lower back pain. Okay, so the three things that I want to go over that can really make a difference in the treatment of your lower back pain and the outcome that you're searching for. One of those things is you want to go slow and controlled. And so it's important to realize what you're doing and why. And really to gather that, you want to go slow and controlled through the movement. When you're first learning it, you want to build that intention and understand it, and then go slow and controlled through the movement. And so, for example, when I teach bridges to somebody, we learn what we're activating, and then we go slow and controlled through that range of motion so you can feel what you're supposed to be feeling, right? And so that's really gonna be a big difference. Some people just go through the range and blah, 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 and they don't pay attention to what they're feeling. Number two being, we don't live by the saying of no pain, no gain, right? We learn how to flirt with pain. And so when you flirt with something, you kind of go to that line, maybe a little past it, and then back, to that line and back. We never blow past it. And so if someone's discomfort's here, we're kind of just flirting with it, hanging around there. We want to maybe nudge it a little bit, but not blow past it, because your tissue irritability could really make the rest of the day uncomfortable for you. And so you want to just learn how to flirt with the discomfort and not blow past it. So we want to go quality over quantity. So we're going slow and controlled. We're going not flirting or not blowing past the discomfort, and learning how to flirt with the discomfort. And then you just want to learn how to be intentional. And so when I teach someone how to bridge, we go over this concept of motor control. And so we learn what to activate and when. And so these are early steps into the recovery process, right? So we're learning how to activate certain musculature and what that should feel like, because that is important. If you understand the why behind it, you can learn how to build upon it for the stuff that we're going to do further down the road, and more importantly, into the functional daily tasks that maybe you're having problems with. And so slow and controlled, only flirting with the discomfort, not blowing past it, and then learning motor control of like how to activate and why and what and when. And so those are all important things to consider, and really what can make the difference between 50% recovery and 90% recovery. And so physical therapy for lower back treatment and exercise and for relief and mobility is very effective, but we boil down to the basics and use those three pillars that I just talked about, among other things, to help you get the outcome that you deserve. And so if you guys like what I'm putting out there, please subscribe to the channel. If you're in physical therapy right now or considering the future, just make sure you keep those things in mind. But otherwise, guys, stay healthy, keep moving, and take care of yourself.